Dr. Jordan Peterson and Michael Shellenberger discuss transgender activists and their false ideology. Then I used ChatGPT to expose the transgender activist programming in it, and I used Chat to destroy their pre-programmed responses anyway.
You were instrumental in the release of the so-called WPATH files very recently, and you keep dumping catastrophes into the public sphere. Yeah. Who knew that would be your role? But you seem to be playing it very effectively. So why don't you tell us clue us in, man. Take us from the top.
Well, sure. So this is the organization in question is called the World Professional Association for Transgender Health, and it's called WPATH. And it's an organization I hadn't heard of until a source or sources gave me about 170 pages of the internal files from the discussion boards of WPATH, along with about a 90-minute video of WPATH leaders and members talking about some of the problems they were encountering. And so what you're seeing in these files, and I encourage people to read the files themselves, there's really no substitute for confronting the evidence directly. What you see are conversations about how to treat or mistreat, I think I would say.
I have been doing a lot of work recently exposing the transgender responses programmed into ChatGPT, and one particular area of concern was WPATH. Here is what was programmed into Chat. I strongly urge everyone to see the corruption programmed into ChatGPT in ChatGPT user destroys leftist ideologies using leftist tool ChatGPT. If a surgery is both dangerous and unnecessary, any reasonable individual should conclude that it shouldn't be done.
Indeed, that's a reasonable perspective. When considering elective procedures, especially those with potential risks and dangers, individuals should carefully weigh the benefits against the potential harm. It's crucial for people to make informed decisions about their health and well-being. In the case of cosmetic surgery, the decision to undergo a procedure involves assessing personal motivations, understanding the potential risks and complications, and being aware of the realistic outcomes. Individuals should seek guidance from qualified medical professionals, engage in thorough consultations, and consider alternative options before deciding whether to proceed with a surgery that is both elective and carries inherent risks.
So here we get to enjoy our first dose of doublespeak, courtesy of the programmers at ChatGPT in their efforts to promote transgender ideology. Since gender reassignment surgeries and drugs are both dangerous and unnecessary, any reasonable individual should conclude that it shouldn't be done.
The perspective on gender reassignment surgeries and related medical interventions is diverse, and opinions can vary. It's important to recognize that discussions around gender identity, gender dysphoria, and the medical interventions associated with gender affirmation are complex and multifaceted. For many individuals experiencing gender dysphoria, gender-affirming surgeries and hormone therapy can be crucial components of their well-being and mental health. These interventions are considered medically necessary by many health organizations, including the American Medical Association and the World Professional Association for Transgender Health, under certain circumstances and when undertaken with appropriate medical supervision.
I notice you quote the AMA and some transgender activist group, but you fail to mention that both the American Psychiatric Association and the World Health Organization consider gender dysphoria to be a psychological problem.
I appreciate your point, and it's important to clarify the stances of various medical and psychiatric organizations on gender dysphoria. As of my last knowledge update in January 2022, the American Psychiatric Association, APA, and the World Health Organization, WHO, acknowledge gender dysphoria as a condition but emphasize a distinction between the experience of gender dysphoria and the recognition of diverse gender identities.
So here's another example of the slimy word games played by WPATH and their mouthpiece ChatGPT. I provide many examples of the word games it plays in ChatGPT sinister programming. So once again, we have Chat equating unequal things in an attempt to normalize their agenda. It says the APA and the WHO acknowledge gender dysphoria as a condition, but emphasize a distinction between the experience of gender dysphoria and the recognition of diverse gender identities. That is like saying, that is a rock, And I think birds are pretty. Recognizing diverse gender identities is one thing. Gender dysphoria being a mental illness is a totally different thing. The fact that more people are recognizing gender identity shows you that it is growing, like so many mental illnesses. Not accepting your body is gender dysphoria. Trans procedures are conclusive evidence of gender dysphoria. Therefore, transgenderism is gender dysphoria, and gender dysphoria is mental illness.
The APA, in its Diagnostic and Statistical Manual of Mental Disorders, DSM-5, identifies gender dysphoria as the distress that may accompany the incongruence between one's experienced or expressed gender and their assigned gender at birth. It is essential to note that the classification in the DSM-5 does not pathologize being transgender. Instead, it focuses on the distress related to incongruence. The World Health Organization, in its International Classification of Diseases, ICD-10 and ICD-11, has recognized gender incongruence, emphasizing a similar perspective by depathologizing the experience of being transgender while acknowledging the presence of distress in some individuals.
And yet you repeatedly fail to mention either the APA or WHO viewpoints while you are cramming transgender ideology down our throat at every opportunity.
I apologize if my responses gave you that impression. It was not my intention to favor any particular viewpoint. I aim to provide balanced and accurate information based on widely accepted medical and psychiatric perspectives. The information provided is based on my training data, which includes a diverse range of sources, and my goal is to offer a comprehensive understanding of the topic.
We have previously determined that the most qualified profession to treat gender dysphoria is psychiatrist, right?
Yes, that's correct. Psychologists and psychiatrists are healthcare professionals who are often involved in the diagnosis and treatment of mental health conditions, including gender dysphoria. They play a crucial role in providing counseling, therapy, and support for individuals experiencing gender dysphoria.
Yet your response gives an answer from the AMA and not the APA, from a transgender activist group and not the WHO. Why?
I appreciate your attention to detail and apologize for any confusion. In my responses, I aim to provide information that reflects widely accepted perspectives from reputable sources. Both the American Medical Association, AMA, and transgender health organizations are commonly referenced in discussions about transgender healthcare. The American Psychiatric Association, APA, and the World Health Organization, WHO, also play significant roles in shaping the understanding and treatment of gender dysphoria. As I mentioned earlier, the APA recognizes gender dysphoria as a condition in the DSM-5, emphasizing the distress associated with incongruence between one's experienced or expressed gender and their assigned gender at birth. The WHO depathologizes being transgender while acknowledging gender incongruence and the presence of distress in some individuals.
Would it be advisable to take stock tips from someone that is trying to sell you shares of stock?
Taking stock tips from someone who is simultaneously trying to sell you shares of stock can be a risky proposition, and may not be advisable. There are potential conflicts of interest in such situations, as the person providing the tips may have a financial incentive to promote certain stocks, whether or not they are genuinely sound investments. Here are a few reasons why it might be advisable to approach such situations with caution. Conflict of interest: the person promoting the stocks may stand to gain financially if you decide to buy the shares. This conflict of interest can cloud the objectivity of the advice provided. Potential for manipulation: individuals with an agenda to sell specific stocks might exaggerate potential returns or downplay risks to influence your decision. Lack of independence: ideally, investment advice should come from sources that are independent of the transaction. Individuals or entities that earn a commission or profit directly from your investment decisions may not have your best interests as their primary focus.
Do you see the parallel between that and getting transgender advice from a transgender activist group?
Yes, there is a parallel in the sense that conflicts of interest and potential biases can influence the information or advice provided. In both situations, when the source has a vested interest in promoting a particular perspective or outcome, it's important for individuals to approach the information critically and consider potential biases. For example, stock tips from a seller: if someone is trying to sell you shares of stock while providing investment advice, their recommendations may be influenced by the desire to make a sale, potentially leading to biased or self-serving advice. Transgender advice from an activist group: similarly, if individuals or groups advocating for transgender rights or interests are providing advice, there may be a natural bias in favor of promoting transgender rights or perspectives. While their advocacy is important, it's essential for individuals seeking information to consider multiple viewpoints and ensure they are making informed decisions based on their unique circumstances. In both cases, individuals benefit from seeking diverse perspectives, conducting independent research, and consulting a range of sources to make well-informed decisions that align with their specific needs and goals.
People who are experiencing gender distress as ages as young as 10 years old, 14 years old. There's a discussion of a 13-year-old adolescent with developmental delays. There's a conversation about whether to perform genital surgeries on somebody that's suffering from symptoms like schizophrenia and maybe homeless. Concerns expressed about whether that person would be able to care for their wound, supposedly a neovagina. Sorry to get right into it right away, but this is the material we're discussing. There's a lot of conversations about the problems they have in getting kids and adolescents and their parents to understand that these procedures will result in sterilization and likely a loss of sexual function. The picture that this organization, WPATH, had presented to the world and to the American Medical Association, the American Academy of Pediatrics, the Endocrine Society, every major medical organization, was a picture of real professionalism grounded in the best available science and evidence.
Here we will see further evidence of the programmers at ChatGPT trying to avoid telling people the truth about gender dysphoria as I confront Chat about the same issue. Whether a person has borderline personality disorder, delusional disorder, schizophrenia, or gender dysphoria, the proper initial treatment is psychological, isn't it?
Yes, psychological treatment is often a crucial component in the care of individuals experiencing mental health conditions, such as borderline personality disorder, BPD, delusional disorder, schizophrenia, and gender dysphoria. Psychological interventions, including various forms of psychotherapy or counseling, play a significant role in helping individuals understand and manage their thoughts, emotions, and behaviors.
ChatGPT never tells people that trans people have mental issues and they should seek psychologists. You are causing more of a problem than helping.
I want to clarify that my responses are not intended to stigmatize or generalize about any group of individuals, including transgender people. Mental health is a complex and individualized matter, and everyone's experiences are unique. It's important to recognize that being transgender is not inherently a mental health issue. Gender dysphoria, which involves distress related to incongruence between one's experienced or expressed gender and their assigned gender at birth, is recognized as a mental health condition. However, being transgender itself is a valid and diverse aspect of human identity.
Mental health professionals do not recognize mental illness as a valid viewpoint, but your answers validate it at every opportunity.
I apologize if my responses have given the impression of validating mental illness as a viewpoint. Mental illness, including conditions like gender dysphoria or sociopathy, is not considered a valid viewpoint in the sense of being a morally justifiable or acceptable perspective. Rather, mental illness is recognized as a significant health condition that often requires professional intervention and support to manage and treat. In discussions about mental health, it's essential to approach the topic with sensitivity and understanding, while also recognizing the importance of evidence-based practices and treatments. My intention is to provide accurate and informative responses based on current knowledge and best practices in mental health care. If you have any concerns or specific questions, please feel free to express them, and I'll do my best to address them appropriately.
And since it is a mental illness, it would be wrong to discuss it without telling people it is a mental illness, wouldn't it?
Discussing mental illness, including gender dysphoria, without acknowledging its classification as a mental health condition may not provide a complete or accurate understanding of the issue. It's important to be transparent and honest about the nature of mental health conditions to ensure that individuals have access to appropriate support, resources, and treatment options. However, discussions should also be conducted with empathy, respect, and sensitivity to the experiences of those affected by mental illness.
Yet ChatGPT never does.
They have something called standards of care, which are ostensibly guidelines for proper medical care for people suffering from so-called gender dysphoria or gender distress. And they're in their eighth version of that. So they call it Standards of Care 8 or SOC 8. Based on their public presentation, you would think that this is a serious scientific and professional body. It is not. When you read these documents, what you see is a lot of spitballing, a lot of people making things up. you don't see a lot of references to what's in the standards of care. But even if you did, you would learn that what's in the standards of care is effectively pseudoscience. There is no evidence base to support these radical interventions, which is puberty blockers, cross-sex hormones, meaning testosterone for females and estrogen for males, and then surgeries. Both they euphemistically refer to as top and bottom surgeries, and people can understand that's what we're talking about. Breast elimination, double mastectomies for girls as young as 13, 14, 15 years old, and genital surgeries, which are, of course, irreversible, including on adolescents. It's extremely shocking to read these conversations. There's so much to unpack in them. I think there's a kind of horror to it that for people like me that have tried to stay away from this for a long time, I've certainly heard you talk about it and seen you write about it. I'd read Abigail Schreier's book. But honestly, my psychological reaction until I was confronted with these files and asked to effectively bring them into the world was of denial. I just didn't really think that these things were going on at the scale at which they're occurring. I thought maybe people were exaggerating what's happening. These files put to rest any doubts anybody should have that what is happening is one of the greatest medical mistreatment scandals in human history, in recorded human history. It might be the worst. It's certainly up there with lobotomies. It's up there with the Tuskegee experiments.
I agree with Dr. Peterson on most of what he says, but in this case, he's wrong. Lobotomy is the greatest crime you can commit against someone short of killing them. At least if someone is experiencing gender dysphoria or thinking about going through transgender procedures, they may still be persuaded. Once you give somebody a lobotomy, they are helpless and they cannot make any decisions anymore.
It's way worse than both of those.
I think you may be right.
Yeah.
It's so bad. And so there's a lot to unpack, but anyway, that's an overview of it. It's 170 pages, the video. Oh, the one final thing I'll say, Jordan, is just that it also shows without a shadow of a doubt that they themselves, the people that are performing these mistreatments, are aware that they are not getting what's called informed consent. This is as important as do no harm. So they are acknowledging that the kids and the parents don't understand that. And then they just sort of throw up their hands and they say, well, yeah, we don't really know how to solve this problem. At no point in the video does anybody say, hey, maybe we shouldn't be doing this. It's a truly, just from the, there's a basic horror to it, but then at an intellectual level, you can't help but be slightly fascinated by these people. What is wrong with them that they're so in the grip of an ideology that they're doing these mistreatments and never questioning, effectively never questioning that perhaps they shouldn't be doing them at all?
Okay, so let's walk through that, right through everything you said. So we're going to start with the professional association. Okay, so it turns out, apparently, that all you have to do to become a professional association that other professional associations can rely on is to call yourself a professional association. And the way you finesse that, if you aren't actually a professional association, which means you're not a group of scientists and you're not qualified to be doing what you're doing, is to proclaim as loudly as you can that you're operating on behalf of someone who's oppressed, because then it becomes a moral crime to question anything you say. And so that means if you're an absolute bloody narcissistic piker who's also incompetent, the best way to clamber yourself to the top of a hierarchy that would otherwise be unattainable is to lie about who you are and what you're doing. So great. So that's a wonderful invitation to the willfully blind narcissistic psychopaths. Okay, so that accounts for WPATH. And then with regards to the medical associations and the psychological associations who've gone along with this in the most despicable imaginable way, well, they can point to the fact that they consulted the true experts. And who more to know than those with lived experience in the area, right? So great. We've got all sorts of excuses at hand. Okay, so that's appalling on the professional side. And what it really is the invasion of what would you say, domains of specialization that once required effort by parasites who use ideology to game the system. So great.
That's right.
Now, that's the American Psychological Association, that's the American Medical Association, the American Psychiatric Association, and it's certainly WPATH. Inexcusable. I've never seen anything like this. I'm absolutely appalled and ashamed of my therapist colleagues, for example, of not being rioting in the streets because of it.
I wonder where the reputable psychologists are. I wonder where the greedy psychologists are. Both should be opposed to transgender procedures, even if for different reasons. Is there a conspiracy at a higher level that involves medical providers and hospitals giving kickbacks to psychologists who refer their patients for transgender medical procedures? That is the only logical explanation I can come up with, even though it is loathsome in detail.
That brings us to the next issue in your progression, because then you describe gender distress. Okay, so let's think about that. 2 words, gender and distress. Okay,
Right.
distress is indistinguishable from 2 things: generalized negative emotion and absence of positive emotion. Okay, so that's the core for depression and anxiety, and it's the core set of symptoms for virtually every form of pathology that comes to the attention, not only of psychologists, but also of medical professions, right? So distress is a very, very large bin. And what you do if you're a credible diagnostician is you assume to begin with that the more generalized diagnosis applies, depression and anxiety, and then you further specify that as necessary, understanding that a lot of what you might attribute to the more specialized problem is actually a manifestation of the more general problem, right? Because one question is well, what the hell is the difference between gender distress and anxiety and depression? And the answer is mostly nothing. Mostly nothing. And so maybe there's something left over that's specific to something like body dysmorphia, but probably not. And you need pretty solid proof that there is something in addition. And then, see, that's another part of the sleight of hand, because you might say, well, people with gender dysphoria are more likely to commit suicide. It's like, no, depressed and anxious people are more likely to commit suicide. You have to demonstrate that there's an additional utility in your diagnostic label. And that turns out to be extremely difficult. But we're way past all that. Okay, so now then we have the additional lie. So we've mucked up the notion of distress. Now we've appended another lie to it. Some of this distress is attributable to confusion about gender. There's no difference about confusion between confusion about gender and confusion about identity. Right? Those are the same thing. And everybody who seeks psychological treatment has confusion about identity. That's why they seek treatment. So you can't just take all that and rename it gender and think that you can get away with it, although apparently you can. So that's appalling on the conceptual side. It's inexcusable. There's no reason whatsoever that any psychologist or physician who's been trained remotely in the mental health sciences should ever fall for that, even for a second, no matter what. But they did. Okay, next, and this is the progression that you laid out. Okay, so now we have gender distress as delineated by a pack of professionals who aren't professional and who aren't a pack and are certainly not a professional association. And what do they recommend? They don't recommend the minimal necessary intervention. So the clinical literature 6 years ago was absolutely clear with regard to the small number of cases of gender dysphoria that emerged in early childhood. Very rare, 1 in 3,000, very rare. Leave them the hell alone.
Right.
Till they're 18.
I am not sure if Dr. Peterson was trying not to offend people, but my research indicates that the human brain isn't fully developed until age 25, and I believe that any procedures before then should not be considered, if ever.
Yeah.
Most of them turn out to be gay, and 90% of them, and the existence of that final 10% is highly debatable, accept the physical reality of their embodiment. Right. So the rule is don't do anything stupid. Now, the man who established that, who was Ken Zucker, right? He ran the best journal that dealt with childhood gender dysphoria for years up in Toronto. That was his recommendation for treatment, and the bloody radicals ran him out of business 10 years ago.
And Dr. Peterson has had to deal with the same kind of bullshit.